So hi everyone, it's great to see so many of you here with us today. We know that this report has generated a huge amount of interest, so we're really excited to present it to you and have some time for discussion with the team from Anglia Ruskin. We want to ensure enough time to take some questions at the end, so I'm going to get started and we can let people join as we go along. Okay. So welcome to our online launch of the Simulation in Nursing Education and Evidence Base for the Future report. We know that this has been a really highly anticipated piece of work, and we in the research team at Anglia Ruskin are very excited to publish it last week. The full report and executive summary were published on our website last week, so hopefully some of you will have had a chance to look at it already. So I'd like to introduce the research team from Anglia Ruskin University who are joining us today to present the key findings of their research. So we're joined by Dr. Mary Edmonds, Deputy Dean for Practice Learning and Simulation and the Research Project Lead, Professor Catherine Meads, Professor of Health and the Deputy Research Project Lead, Dr. Naeem Abdulmogdi, Senior Lecturer and Course Lead, Dr. Sian Shaw, Associate Professor of Digital Innovation in Nursing, and Dr. Louise Prothero, Senior Research Fellow at Anglia Ruskin University. So it's been a real pleasure to work with the team on this project, and you will see from the size of the report and how robust the research is, the enormous amount of work and dedication that they've put into it. So I'm going to just begin by providing a bit of contextual background around why this report was commissioned, and then I'll hand over to the team. So as I mentioned, there was a huge appetite for this report within our membership and among stakeholders and partners as well. Our members were really keen to have an evidence base to determine the value of simulated practice learning within nursing education, thinking about, is it worth the investment? What benefits can it bring for student experience? How can it support with placement capacity challenges that we hear about all the time? And what opportunities are there to embrace it and collaborate on it together? We know that the healthcare education sector is under very diverse pressures, many of which were exacerbated during the COVID-19 pandemic. This also revealed the resilience and the adaptability of our membership, though, in their ability to quickly implement new practices and innovations to support student learning, which are showcased in our pandemic-powered improvements report, which you can also find on our website. So we really want to keep up the momentum for this and keep driving and facilitating such innovation. There's also been quite a few recent regulatory and policy opportunities for simulation. So Brexit recently opened opportunities to explore alternative regulatory approaches, including around simulation. During the pandemic in 2021, the NMC introduced emergency standards, allowing for up to 600 hours of simulated practice learning. And since, these standards are now permanently adopted by the NMC for approved institutions. The NMC has also recently launched a review into nursing and midwifery practice learning, and we know that this report will serve as a strong evidence base towards that. And lastly, the recent NHS England's long-term workforce plan calls for further regulatory change in nursing and asks universities to adopt at pace the updated standards on simulated practice learning already introduced by the NMC. So apart from, there's obviously a lot of opportunities, but likewise, we know that members face a host of challenges in trying to adopt and deliver simulation. There's a huge amount of resource and cost pressures. So the equipment is very expensive. You need those highly trained staff. You need to keep them up to date with training, and you need that physical space and facilities and time in students' timetable to fit it in. So these challenges have led to some inequalities in the capacity of universities to adopt simulation. So I'm sure you'll agree that this report is extremely timely and will help inform future decisions around the use of simulated practice learning in nursing education and also potentially beyond within midwifery and AHP education. You will also see that the findings have informed our own policy positions at the Council in our manifesto paper for the upcoming general election. We do have a specific ask around sustained capital investment and a more adaptive regulatory framework to further embrace simulated practice learning and technologies in promoting patient care. So I'm now going to hand over to Mary and the team to present the research, and then we'll have some time for some audience questions. So please do post questions in the Q&A box as we go along. Thank you very much.
Thank you, Megan, for introducing the context for why we undertook this research report. I'm really pleased to be able to do this presentation along with my team, and we will be presenting the aims, the methods, the key findings and the recommendations that we have in the time allowed. Next slide, please. So the purpose and the scope of this research project was to investigate how simulation-based learning for nurse education can transform practice learning. The focus was on pre-registration nursing, and we wanted to explore how different approaches with simulation and technology could really help in terms of different learning opportunities for the students. We also wanted to look at the different types of emerging technology that was happening within university settings. And finally, we wanted to map the ability of simulation to meet the future nurse standards. Next slide. So we, in looking at these different aims, we undertook 4 methods, and each team member will be presenting these methods. Next slide. I'd like to hand over to Catherine.
Thank you very much, Mary. Now, myself and Louise were doing the systematic review and reviews part of the project. And I'm a specialist systematic reviewer, so I tackled this topic in the same way as I would tackle many other topics that I've done in the past around establishing a very strong evidence base. And what we needed were studies that compared simulation education to patient or practice-based learning in undergraduate nurses, where both groups were assessed in the same way, not by self-report, but by competency tests conducted by the staff, OSCEs or exams, external exams, knowledge scores, and so forth. So you could really tell whether both groups were learning as well or better from each other. So once we finished the systematic review, then we matched some of the interventions to proficiencies that are listed in the Future Nurse Standards. And then a final part of the project was reviewing regulatory standards that looked at simulation-based learning for the education of nurses, undergraduate nurses. Next slide, please. So the systematic review findings, it's much more details in the report itself, but the nub of it is there were 34 included studies. Some of these compared simulation to clinical practice. Some of them compared simulation plus clinical practice to clinical practice only. And some compared more simulation to less simulation. And they varied in size considerably. Some were very big, some were randomized controlled trials, some were case control studies. But it was possible to meta-analyze the numerical results for 20 of them of comparing simulation to clinical practice, and also simulation plus practice versus practice only. And both of those numerical results showed that simulation was either more effective or as effective than clinical practice alone in improving the outcomes measured. So we have got a lot of confidence to show that simulation can replace some clinical practice, and nurses will be as competent in the exams or other assessments used. And then once we finished the meta-analysis, we used the studies that mapped onto the Future Nurse Standards to make sure that the results were robust to the Future Nurse Standards outcomes. And although we didn't have that many outcomes that we could look at, the one that could be meta-analyzed also showed the same result. So simulation is either as effective or more effective than clinical practice alone. And no studies that we included showed significantly worse student assessments for the simulation group. Next slide, please. I'll hand over to Naeem.
Thank you very much, Catherine. So the second phase of the study, we conducted a cross-sectional survey. The survey included members of Council of Dean for who deliver simulation-based learning, part of their nursing courses in the UK. We explored the use and the level of confidence in using different modalities of simulation. The second section of the survey, we explored the organizational readiness for simulation-based learning. And then we had open-ended questions looking at the exploring the opportunities, challenges, and perceived benefits of simulation-based learning in pre-registration nursing courses across the UK. We recruited 60 members. This is an institutional level out of 87, so that's 69% response rate overall. Next slide, please. So one of the major findings that we identified is that the higher level of technology required in the simulation modality is associated, just one second, sorry. Just can't see that. So the higher level of technology required in the simulation modality, the lower the staff confidence and the use of that modality. So how did we come about that conclusion? What we noticed that there was high level of confidence and use in the low fidelity simulation, for example, and there was a moderate to low level of confidence and use when we used high fidelity simulation or virtual reality or augmented reality. So that's quite an important finding to identify. The second thing is the organizational readiness. The organizational readiness tool identified a couple of things. First of all, the level of readiness was moderate across the UK, it's 137 out of 180. There was key things in the readiness survey that has been identified, such as having staff who have a credential and knowledge and skillful staff in the use of simulation was very low in terms of their mean score. The second thing is the staff proficiency in technology and digital literacy was a second area that was identified to be having a low mean score in the organizational readiness. And finally, the requirement for the admin support. So overall, the message here between the organizational readiness section and the confidence and the use indicates an important message about the staff abilities in using technology. Now, when we go to the open-ended questions, the perceived benefit are very similar and consistent with literature. So they perceive the benefit of simulation in enhancing student experience, satisfaction, knowledge, and the skills, and obviously improving placement capacity. In terms of challenges, there are a few challenges have been identified. Again, knowledgeable staff and skillful staff, plus as important as Megan has said at the introduction, the infrastructure, space, and equipment was a critical area that we have identified. Another one that was really major findings was the commitment from the faculty leadership and the recognition of the value of simulation in nurse education. Next slide, please. I hand over to Sean. Thank you.
Hello, everybody. With Mary Edmonds, we did an in-depth case study looking at simulation at Anglia Ruskin University. And we looked at two groups of students, second-year student nurses, mental health group of student nurses. There were 93 students and 22 of them completed the survey, and there were 58 child nursing students and 26 completed the survey. And the reason we chose those groups, it was opportunistic. It was the groups that were running during the time we had to complete the research. And actually it's useful to do child and mental health because a lot of the published data is actually on adult groups of students. So there's some novelty in that. And we also did a focus group with 4 of the academics who worked as practice supervisors. So the Anglia Ruskin academics acting as practice supervisors for the mental health students. And again, the reason why we didn't do the child focus group at that point in time with their academics is there wasn't sufficient time in terms of getting this ready for publication. So for the student nurses, it was a self-reporting student survey, and self-reporting because actually the simulated practice learning wasn't actually summatively assessed. Both groups of students undertook a 2-week simulated practice learning, which was run online via Canvas, out of a 5-week placement. So they did get some experience in clinical practice as well. And they also had 5 days of clinical skills. It's important to note the difference between how those clinical skills were actually put in the mix, in that for the mental health students, the clinical skills sessions were interspersed with the SPL. So they were mixed up with the days, whereas with the child students, the clinical skills were before the students actually had the simulated placement learning. And that's has important repercussions, which I'll explain later. Yes, and the focus groups with the practice supervisors who are the academics. Next slide, please. Okay, so what we looked at is we looked at a couple of things. So on the survey, one of the things that we looked at was the increase in confidence and range of clinical skills. So they did increase in confidence, they thought it was engaging, and the students actually reported they developed skills and knowledge that would be useful for them in clinical practice. What we did in the self-reporting is we got the students to self-assess themselves against the Future Nurse Standards, the NMC Future Nurse Standards. So both groups of students, the mental health and child, had targeted proficiencies which were identified by the course leaders from those Future Nurse Standards. And those were actually from the practice assessment, the Midlands and East practice assessment document for year 2. So we looked at the normal proficiencies that they would actually achieve. So with the proficiencies, so they had targeted proficiencies. It was 10 for the so it was 10 targeted proficiencies for the mental health students and 9 targeted proficiencies for the child students. But we got the students to self-assess all those proficiencies. And what we found is that the mental health students actually did better in achieving the targeted proficiencies. And the reason for that is that the modality of simulation was more appropriate for the proficiency. And that's what there are lots of different ways that you can deliver simulated learning, but what you have to think about very carefully is, does that simulation match the proficiency or appropriate for the proficiency that you're trying to actually achieve? So the child students did achieve proficiencies. It's not that they didn't achieve proficiencies, but they didn't do particularly well in the proficiencies that were targeted. They achieved other proficiencies. And what the child students had actually done, the child academics, is they'd looked at targeting proficiencies that were difficult to achieve in practice, which is a very useful thing to do, but hadn't necessarily thought about those that were actually achievable. But both groups of students achieved a good amount of proficiencies that they were actually looking at, and the actual numbers are in the report. From the focus groups, they were very enthusiastic. The academics were very enthusiastic about actually using simulated practice learning, and a strong desire to actually continue to do it. But one of the key things that actually was recognised is it was very, very resource intensive for the academics to actually run. Next slide, please.
So in the final phase of the research, we undertook focus groups with members or universities who had received approval from the NMC to provide simulated practice learning. This provided us the opportunity to understand from those different universities their motivations for seeking NMC approval, their experiences of the approval process, what are they actually doing in their universities to provide students with those learning opportunities, how were they using the technology, how were they using simulated practice learning, and to understand their positive experiences, so what had gone well, but also what had perhaps been more challenging, what had been difficult, and more importantly, how have they actually overcome those challenges with different solutions. So we interviewed 12 members of universities who were members of the Council of Deans of Health who had received NMC approval. Next slide, please. So thematic analysis of the focus groups, and we actually ended undertaking more than one focus group, and that was really again so that we could ensure that we got good participation and feedback from the different universities. Revealed some of the drivers about actually why they had decided to seek approval from the NMC to have simulated practice learning hours delivered. And then the initial demands were really about the placements during COVID. So as we'll all be aware, is that there was difficulties in sometimes students having the placements that they needed at the certain points of the programme. And simulated practice learning provided that opportunity to enable students to progress, to enable students to achieve proficiencies that they needed to complete, but also in some cases when there's been harder to reach or harder to achieve proficiencies in the clinical settings. And also, I would say the rapid growth in student numbers as well was something that, again, was enabled to be managed with simulated practice learning. We asked the universities about their experiences of going through the process, the approval process with the Nursing Midwifery Council. And overall, it was seen as very supportive. It was seen that actually the support that they had received from Paula Holt had really helped and made a difference in getting through the application in terms of what was needed and what they needed to demonstrate. But there were some anxieties expressed from the group, and they were in particular around what were the regulatory requirements, how would they demonstrate those requirements, how was it being defined? So how was simulated practice learning being defined? How could that be demonstrated in what they were doing? What hours could be used? And I would say again, in terms about the terminology, so again, making sure that there was consistency in how that terminology was being demonstrated. But always, I would say that with an overwhelming knowing about obviously what is needed in terms of those regulatory requirements. They described themselves as trailblazers. It was really felt again that there was a very strong identity between those who'd received that approval from the NMC. They really felt that they were trying out and using quite innovative approaches. Something that again came up when we did the survey in the cross-sectional survey that Naim made reference to and was talking about. So there was a real sort of innovative way to sort of be thinking about different experiences, how to ensure that students got a wide range of knowledge, skills and behaviours. The simulated practice learning was evident throughout all parts of the nursing curriculums, but most prevalent in year one. Really was being very much used for preparing students to be going out for their initial placement. But certainly, again, it was seen as a way to be preparing, say, also the third years as well in terms of those leadership aspects. From within the group, simulated practice learning was very much seen as enhancing practice rather than perhaps replacing clinical practice, and that was quite a sort of strong emphasis on that. But there was also an acknowledgement that this is a very evolving and dynamic way of providing learning to our student nurses. There were concerns from the group about resourcing and sustainability, costs for starting up, costs for technology, identifying different software that was appropriate for meeting students' needs, the equipment, staffing, preparation for those staffing, and again for the learning spaces that would be used for simulation. Next slide, please. So in terms of the recommendations, and there are quite a few, and I would very much strongly encourage you, if you haven't already, to read the main report and the executive paper as well. But the sort of key points were that, as Catherine outlined in the systematic review, is that there is an evidence base to support simulation-based practice learning in nursing education and to replace some parts of clinical practice. And that is something that, again, hasn't been identified in previous reviews. The cross-sectional survey reflected the need for university to self-assess their capacity and their readiness that from an organisational point of view in terms of that technology, staff preparation, faculty expertise, evaluations of cost. The report recognised the need for ongoing research. So we need to do more research about measuring the impact and the benefit on student learning. And in particular, we've found that actually there needs to be a standardised approach to evaluation. So currently universities are all measuring, evaluating those experiences, but actually having a standardised approach would make sure maybe in terms of that more consistency, but also learning across the 4 nations. And also the timing of evaluation. So actually when those evaluations undertaken to really understand that benefit on student learning. Funding was certainly an area that came across all the phases, and funding across all 4 nations, and the availability of tariffs across all 4 nations is needed to enable continuing the work that's been undertaken by the universities, but also in terms of that readiness to be undertake simulated practice learning. And finally, I would say there was a real motivation to share lessons learned. So the work that's been already undertaken by the universities that have received approval and are undertaking simulated practice learning, there was a real keenness to want to actually share together, to collaborate, universities to collaborate together to understand how challenges can be overcome and how solutions can be found and how to share good practice. I would like to take this opportunity to thank everybody who has contributed to this research project and or who has possibly participated in the different phases that we did. And if you'd like to have a further conversation with us, we very much welcome that after this webinar. Thank you.
So thank you very much to the whole team for providing such a great overview of the key findings and key messages that came out of the report. I'm sure you'll see that it's such a comprehensive and robust review of simulated practice learning with the 4 different research phases. So it's really exciting to share it with you all. We've now got some time for some audience questions. So I would like to encourage you all to put some questions in the Q&A box for the team or the chat box. I'm going to kick us off, if that's okay, with a question myself. So I think one of the key messages that stood out for me from the report was that simulated practice learning should be used to enhance clinical practice, not necessarily to replace it. So can you tell us a bit more about what you mean by that and expand on it a bit further?
Perhaps if I make a start and then I can hand over to colleagues. So I think what we've discovered in this report is that there are different perceptions about simulation and practice learning and simulation-based education. So as we've identified is that the systematic review does demonstrate that there is the opportunity to replace some practice learning in terms of the outcomes that are being measured. Whereas the survey and the focus groups demonstrated that actually there is a desire and certainly again an ambition to really be thinking about how simulation can enhance practice learning. But I think again it was very evident from the time that we did this research that it is a very evolving situation, and again there's a lot of learning going on about how that simulation can benefit. So you know, and as we showed is that depending on the modality of simulation that's being used, it certainly does enable the students that they feel that they've got that increase in knowledge and skills and their behaviours. Any comments from the rest of the team? Catherine?
Yes, thank you. I think the debate around whether you use simulation to enhance or to replace is actually a very important one. And it was the main focus of our systematic review is to check the evidence around whether you could actually use simulation to replace some clinical practice learning. And, you know, conceptually, I thought of this as, you know, if you have a nurse who is learning how to do a catheterization, should their first catheterization be on a patient or should it be on a simulator? And it seemed to me that actually it seems a very valid thing to do to use simulation to replace some practice learning.
Thank you,
if I can build on that, if that's okay, you know, when we did the different you know, research methods here, Catherine identified that you know simulation can replace you know practice learning, but when we did the focus group and the survey, there was still that perceived approach that it can enhance it rather than replace it. So it's probably there is a need to educate people about the evidence that are there that you know demonstrate that it could replace aspects of some of the learning outcome. So I think there is some work that needs to be done there because different methods shows slightly different findings, and that's really important to educate you know those who are in the field about the potential benefit of simulation.
That's great. Thank you very much. And I think it's a really interesting debate around whether it enhances or replaces clinical practice. And I think also when you're looking at the UK, there are perhaps varying levels of placement capacity across the country. So some might say if they've got capacity in place at the moment, why should they be pursuing simulated practice learning? But obviously from your findings, there are a huge amount of benefits for student and for the delivery of education. So yeah.
I mean, maybe just to add, Megan, I think again, you know, what we've achieved with this project is that we've opened up the conversation that is much needed about simulation and what it can and what it can't do and what its potential is. And we're on a trajectory with that simulation practice learning. We've got a relatively small number of universities who are have obviously been approved in terms of the simulated practice learning, but we've got obviously lots of universities that have been using simulation in many different ways already. So it's really, again, I think about that collecting the evidence, really having a much better understanding of what is happening, and that really goes back to our recommendations about, again, doing further research on this to measure that impact and benefits.
Yeah, definitely. And there's a huge list of kind of further avenues of inquiry you'll see at the end of the report. So I do recommend you take a look at that. So I'm going to turn to the first few questions. I can see, Sian, you started answering one of them. But someone has asked, could you give a bit more detail? Oh, sorry, wrong one. How can universities collaborate on the delivery of simulated practice learning? And there's a related question about whether we need a kind of national approach to this.
Well, I'm going to say this is music to my ears, these questions, because that is certainly the feeling that we came in with. Myself and Naeem conducted the focus groups, and I would say that was an absolute privilege to be involved in those focus groups and be hearing the experiences of other universities that were using simulated practice learning. So we absolutely do need to come together. There are a number of groups, I would say, that already exist. Maybe from a regional perspective, there is a group that Paula Holt chairs. It's the UK Simulated Practice Learning Group. So those conversations are already starting, but we need to think about actually how we have that a more of a reach. And that is something that I've already had some discussions with the Council of Deans of Health again about how we can expand on that to keep this conversation going, but also to share that good practice. Any other colleagues wish to come in?
Can I just say something about experiences and sharing experiences and answer some of the other questions that are in here? Is that I think it's a lot of work. I mean, I've done a lot of work actually creating experiences for students, and there's an awful lot of work actually creating those and knowing how to create them. And I think there's certainly knowledge exchange in how those experiences are creating, and actually maybe even sharing some of those experiences. And I'm not saying we do that for free. I think there is some things that we can exchange knowledge, but there may be resources that we've created that we may want other universities to actually purchase. And there may be things that we can share for free, because we're all businesses at the end of the day. And I'll just go to answer, because there's a lot of questions around resources and what is being created. I'd say one of the key things is service users engagement with actually creation, service users actually engagement with actually involvement in the delivery of the SPL is actually really important. And from doing this research, we've actually improved what we're doing because we've learned from actually doing it. So to give an example of what we're creating now, because there are questions on that, we've just run a first year experience which is based around a village called Ruskin Row, which actually uses virtual reality, it uses VR, it uses AI, it's all embedded with assessment within our virtual learning environment Canvas, and it follows it's a community placement, and it follows service users who the students actually meet these service users in the placement, and they follow them through the placement. And actually, as they go on through their second and third years, then they will meet these patients again in hospital and in acute and chronic situations. And one of the things that we did, it's really important how you actually deliver these, and we actually made it as close to clinical practice as we could. So we put the students in what we called shift teams, overseen by a practice supervisor who we tried to remain consistent. It's difficult, but that's the same as in clinical practice, really. So the student, there's questions about how do you get them to engage, and what we've actually found is the engagement on the first couple of days is quite poor, but it gets really much better as you actually work with them. So actually encouraging them, working together in these teams that they become familiar with, the practice supervisors keeping a really close eye on what they're doing and tracking the students with registers, but also we've been peer reviewing so that students actually review what the engagement of their peers actually are. And we have actually found significant improvement from the beginning to the end of the placements. So I'll just leave it there because I could talk forever, but yeah.
Thank you very much, Shan. We've got quite a lot of questions coming in.
I mean,
so there's
Megan, I can see there's some questions about preparation for staff, and I'm going to ask Naeem, because that was something that was very evident in the survey. So there's quite a lot of questions, understandably, about that, because it's a very important part of that.
Thank you, Mary. That's, I think, very critical question. Thanks for those who are actually raising it. It's quite critical in order to demonstrate benefit of simulation and show its effectiveness, that staff are feeling confident and they are developing the right techniques. Those standards, the international standards that ask for facilitations, are really important to look into. There's the new standard that ASPE has released, and the INCAS international standard for simulations are really important. They are based on expert consensus, but there are elements of those are evidence-based. So it's really critical to invest in staff development, from designing the simulation, from briefing to design the simulation activities against the outcome that you are intended to achieve, to debriefing. And all these skills is not enough sometimes just to do training for teaching, the BG certain teaching education. Sometimes you have to have specific tailored developmental sort of courses. And I think there is a question about how the NMC matches their standards with the ASPE, which is in that similar things, that the NMC has obviously their SPL and their like SSSA, the supervisor training, which is their framework, but there's the national and international guidelines for simulation. I think we could marry to some degree marry those together, and people are educated to develop what are the standards of simulation, how can be embedded within the framework for the NMC, because the NMC needs to satisfy their own standard. They can't use multiple standards. We engage with the NMC, and I think that's probably is my suggestions, that we ought to ensure staff are developed to deliver simulation against national and international standards, and obviously, very importantly, to consider the NMC to ensure obviously the engagement and audit trail. So that's the answer for that one.
Thank you very much, Naeem. So we've got a question about how do we standardize this approach? So they've said, I work in a university which has several different campuses, and there are differences in simulation across campuses. So it would be difficult to standardize over different universities.
Maybe I'll take that one, then I'll hand over to Sian. So certainly we're not suggesting that all simulation has to be the same in all universities, because actually simulated practice learning is practice learning. And actually that's not, that's all very different and varies according where students have the placements. What we're actually recommending is the approach to the evaluation. So actually how we capture the benefits, the impact, the experiences of students, their understanding of it. That is more what we sort of recognised through the literature, in terms of perhaps the terminology that's being used to describe simulation, rather than that. So it's really about how we collate the evidence about what is going on and the impact of what is going on, rather than, I would say, everybody is doing the same thing. Sian, is there anything you'd like to add?
Yeah, I think one of the interesting, because what we're trying to achieve is student nurses to achieve the future nurse standards for the NMC future nurse standards. So that's what we want by the end of practice learning. And I think there is something about looking at whether simulation does achieve that, and what simulation achieves different proficiencies. So I think it would be useful to have ideas, if you want the student nurses to achieve these proficiencies, maybe this modality of simulation is effective, and this is a scenario that we can actually use. So I think it would be quite good to have a toolkit where we can actually look at what works for which proficiencies. And to do that, we're going to need to evaluate, aren't we? We're going to need to evaluate how effective different modalities of simulation are at achieving different proficiencies.
And perhaps just to add that, really, is that we've all got responsibility in gathering this evidence to really, again, to really come to, actually the effectiveness, the understanding what it is that simulation can provide to our learners in different settings. And I note that somebody put it in the chat, what about post-reg? Absolutely, this is in terms of education for nursing, but actually what we haven't looked at is the other professions. And again, there's a lot of work that is going on in the other allied health professions. that we need to also be looking at. So we weren't able to do everything, but we wanted, in a sense, to really sort of say understand what is happening now, what is going on, and then really doing that further exploration. Megan, I noticed there's a couple of questions that if that's all right, if I can respond to. So there's a question come up about hours, in the terms of how many hours different universities were using for simulated practice learning. It varied. There was no I would say one number that was consistent. It was again sort of determined by those resources, in terms of what and learning spaces, so where the students were undertaking that simulated practice learning. But again, with a mind of actually how if there was a possibility to increase, how that would happen. In our journey of undertaking this research, we've worked very closely throughout with the Council of Deans of Health, but we've also worked very closely with the NMC. So myself and members of the team and with the Council of Deans of Health team, we met on a regular basis with Paula Holt, and we communicated with her at each stage in terms of what we were doing. We also worked very closely, we had with an expert panels from the Council of Deans Innovation and Pedagogy Groups. So again, we actually attended different meetings to really share what we were doing, because we wanted to get that validation that what we were designing, doing was what was needed. And we didn't want to sort of be told afterwards that actually this is some quite directions. And that was really important, because that has made what we have done more relevant in terms of sort of the ongoing and current needs. I don't know if any of our colleagues want to say, anyone else who we engaged with? No, that's fine. Any other particular questions, Megan?
There's quite a few questions about preparing staff. So someone says, I don't think we need to reinvent the wheel, RE standards, but it is hugely important that we ensure academic staff are adequately prepared to develop and deliver simulation to promote student safety and experience. This would be something else that a national body could develop. And then there was one, do you find a difference in how students were assessed or signed off during a simulated practice learning? Thinking here about how a practice assessor needs to undertake an assessment on a one-to-one basis, which can be difficult when facilitating to a group of students.
I mean, I'm quite happy to answer that one if Mary is, because I had experience of that. Yeah. So yeah, assessment is really, really important. So when you're actually we are still learning, we're all still learning, aren't we, in a pool? And actually more recently, I've been working with our simulated practice team in actually developing their knowledge and confidence. And I think it is a really advanced skill. And one of the things that we've actually found is that it's easy to ask people to create these simulated placement learning, so we're inexperienced and don't have knowledge and skills, but it actually requires really skilled, experienced academics to be able to do it. Now, assessment has to be written within your simulated practice learning. So what I would actually say is our SPL, apart from one that we did in the middle of the pandemic, which actually was summatively assessed, is not summatively assessed. What it is they're developing proficiencies. So we're evidencing developing proficiencies, which can then be used as evidence when they get into their practice. So they're not doing the whole practice in simulation. So they may be doing, so for example, our first just do 2 weeks of simulated learning, and then they're going into practice, which is where they will be summatively assessed. But we're evidencing that in their EPAD. So all the students in the country, well, a lot of students across the UK now use we use the Midlands and East practice assessment document using my knowledge map. So we've made sure that we use the same assessment criteria that is actually available to the practice supervisors in practice when they go there to see the evidencing developing proficiencies. And they also have learning logs. So the students are actually required to complete learning logs every week, so that are in their electronic practice assessment document that can then be seen by their practice supervisors. Because they're working with practice supervisors who are academics, they're also writing reports on these students every day. And one of the things we've instigated now is that when the students are on the SPL, we've put them in shift teams, and then the shift teams in towns, because it fits in with Ruskin Row and the town and all this kind of thing that we're actually developing. So they're overseen. Ideally, we'd like them overseen by one shift leader over the whole thing, but you know, that doesn't work in clinical practice either, but that would be actually ideal. So they get that familiarity and the person gets to know them. But the other thing that we're actually doing is we're looking at peer reviewing as well. So when the students are in shift teams of 6 students, so that they peer review their contributions of their group. And so they're working with those same 6 students through the 2-week placement for their activities. And so if students aren't actually engaging, then their peers are actually actively encouraging them to do that. The other thing is we are actually incredibly strict. So if students don't have their cameras on, we don't include their hours. If they aren't actually, we're not, and I've got it very tightly roped into our canvas so that we can actually see what I've actually, every morning and every afternoon has a developing proficiency activity. So all the students have to actually complete that and actually upload it. And that actually goes into SpeedGrader within Canvas. And we're expecting all students to actually evidence that they've actually engaged by taking those developing proficiencies and having done that, and it tracks it automatically within Canvas. It's a really, really, yeah, I could go on forever, but there's not enough time in this. But, you know, I'm happy to run a seminar just on it at some time if anybody wants.
I mean, perhaps to pick up on the other point I'm making is about staff preparation. And as Sian has alluded to, it is something that does still need further, I would say, expansion on it. And that really, again, sort of comes back to when we did the survey in terms of the different types of simulation that's being used, you know, low tech, high tech, you know, and how they're being used. So it's not just what the technology is, but also how it's being used again. And that was something that was very evident in the survey that Naim undertook with the universities, is the wide variation. So I do think there is more work, as I was saying, in terms of our own university and other universities, the colleagues that we talk to, is about how that preparation is undertaken, because simulation is a different type of learning experience, and it's a different type of teaching experience. But again, this is where I feel that there's real lessons to be learned and shared, because again, universities, in terms of the different ways or what is currently happening, is an area we haven't really tapped into yet. And I say it wasn't something we were particularly focusing on in terms of our research, but it was something that came out of the different ways that we looked at these areas. Naim, is there anything else you would like to say?
I was going just to build on that, Mary, if that's okay. I think the issue here that the staff development is really critical, and you know, there are questions about about our report. We are sharing these information with the NMC. We are engaging with the NMC. We are providing the systematic review. And obviously they're using SSA for practice learning and support. And we are, you know, having all this training for SSA for supporting student in practice. And the same process being replicated in the simulation settings to adhere to their really requirement. I see it as somebody has said in some of the questions. I think there will be some sort of hybrid approach in futures that we are influencing policy and standards, where the standards of simulation could be part of the requirement, not just only looking at practice learning through the practice, is how could we optimize simulation practice learning in university setting to achieve those outcomes. With the report, we did not go in evaluating the transferability of skills from simulation to practice. I think that's a really good question. We have done that, and it would be an area that needs more research. So this is the scope of our research is that we just described today. There are other questions that needs to be answered, and I think there are interesting and excellent questions in the list. I think, you know, we could try to answer it as we go, or, you know, chat about it.
That's great, thank you. And it really does show how it's opened up the conversations, and there's a huge amount of other areas we can kind of explore going up off the back of this with follow-up work. So we're really excited about those next steps too. So there's a few questions about kind of specific uses and specific modalities. So with SBL being a broad approach, do you feel that specific SBL devices, technologies provide better outcomes on certain knowledge, skills, or behaviors? And related to that, does simulation in practice really represent contemporary nursing work across all settings? So I'm guessing that's hinting to, can it provide kind of exposure to those different scenarios, conditions, groups of patients in different settings? Catherine?
Yeah, now the evidence base showed that there was an awful lot of different settings that simulation could replace clinical practice with. There was no evidence on emergency settings because it's very difficult to program that into a study. But so that would just be you would have to sort of develop that kind of aspect in practice, you know, as and when, and find out whether it did work. What was the second part of the question? It was around.
So with it, can it represent different settings, so different scenarios, conditions, groups of patients in different settings?
Yeah.
And are there specific devices or technologies that provide better outcomes on certain knowledges, skills, or behaviours?
Yeah, I don't think the evidence base is quite there on different modalities, and we put all simulation together in one big pot, which is probably a bit of a stretch, but there wasn't insufficient evidence to really look at individual types of simulation. There are systematic reviews which are looking at high-tech versus low-tech simulation, and it'd be worth having a look at those. But since our question after our systematic review is very specific, it can't really be used for answering other questions, similar questions, but aren't quite the same as what we were looking at. That would involve an awful lot more work.
Could I perhaps bring Louise in? Because the other thing as well that we did was that we looked at how the proficiencies mapped against the literature. Louise, could you maybe talk a little bit about that?
Yes, so after we'd conducted the systematic review, we had a look at the actual interventions involved and mapped those to the proficiencies in the NMC standards, and then had a look at the different effects those specific interventions were having. The findings from that were positive, but they were kind of quite limited to specific proficiencies. So it perhaps shows that interventions need to be broader to kind of target more of the proficiencies within the standards, if that makes sense. And that is a paper we'll also be publishing following the systematic review.
Thank you, Louise. And we're really excited to see that follow-up work, and we'll be promoting it through the council as well. So there's a question saying interesting conversations are being had, but we haven't found any robust evidence yet. How many hours of practice learning equates to an hour of simulation? How many hours are universities counting for 1 hour of simulation? So I think this hints at that intensity of simulation and for students.
Well, I'm going to say, you know, that was a question that has been raised to us on this journey of doing this research, and myself and Naeem presented at the summer conference for the Council of Deans of Health, and that was again a conversation that did come up with colleagues, because as we found, and as colleagues who are doing simulated practice learning will know, is actually it's quite an intense, rich experience, because you're actually being very focused on what you're doing and what the purpose of what you're doing, the objective of what you're doing, and the learning that comes from that. So how does it equate? I'm going to say we didn't come up with the answers, but again, we weren't looking at that particular. And that is again where there is more research is needed in terms of that impact. So does 1 hour of simulated practice learning equate 1 hour in clinical practice? It's something that we need to know more about. But it feels again that it's the time to be asking those questions, and obviously again in terms of the work that's going alongside with the NMC as well.
Great, thank you, Mary. I'm going to pick up one last question and then we'll be closing the webinar. So there's an interesting question. I think, Catherine, you've started answering it in the chat, but I'm going to keep going with it. So is there a consensus on how much SPL is beneficial, with the NHS workforce plan recommending a reduction in the students' placement hours from 2,300 to 1,800? 600 hours of SPL would then be a third of the students' clinical exposure learning if they're in their training.
So I would say, oh, Catherine, do you want to go first?
Well, the evidence base shows that actually up to 50% could be replaced, with no particular loss in clinical ability as assessed by the assessments being used. But I think that is a lot of simulation. So and then I'll hand over to Mary.
So I think it's interesting that, as Catherine had alluded, the evidence is indicating that yes, it does have a place, and actually, you know, in terms, it's about measuring those outcomes. And again, I think it goes back to, again, the evidence that needs to be undertaken to measure those outcomes. But certainly I would say that, and it's about actually, again, the type of simulation and what you're doing, and what the outcome is, and that the scenarios are contextualized. And again, they're co-created with service users, with obviously a staff involvement, and again, what the purpose of that is. So, and I would say really are very much looking at sort of the policy and processes. So again, all the things that we, in a sense, I think that we've sort of identified as recommendations are the factors that will make this a conversation or a possibility in terms of increasing those hours. But it's very much about that organizational readiness. Is what's in place going to help you enable to do that? What we didn't look at, and again, it's something that is mentioned in the report, is that there again needs to be more work around looking at why universities haven't applied for to undertake simulated practice learning. So I think there's lessons to be looked at there about those who are doing and those who haven't done, and why and what, and again, to bring that together in a way that will help us make informed decisions for our students.
Yes, definitely. And we're inviting the team along to our nation group meetings in the devolved nations to have some of those discussions, and also in our various strategic policy groups. So we're looking forward to those follow-up discussions.
I mean,
so we're coming.
Maybe making just to finish, I think what this webinar has sort of really reflected is that you know, this is very current, this conversation. There's a real need to look more at what we're doing, how we're doing it, why we're doing it, what it can offer to our students, learning experiences, and obviously ultimately in terms of patient safety. So, you know, but it's really, I'm going to say, it feels like it's opened up the conversation, and I very much welcome having further conversations with obviously attendees on this webinar with myself and the team. We look forward to that.
Thank you so much, Mary, and thank you to the whole team. So we've come to the end of our time now. So I'm going to close the webinar. The team are really happy to follow up with any questions. I know there's been a lot of questions in the chat, so we'll follow up with those afterwards via email. The webinar is recorded, so you can revisit it or share it with colleagues, and we can share the presentation slides as well with you soon. So thank you very much to Mary, Catherine, Naeem, Shan and Louise for joining us today, and thank you very much to the audience as well for joining us this morning. We've been so excited to share this work, and it's great to finally be able to discuss the findings and potential implications with you at last. So just to let you know, we do have a session at Spring Conference in London on the 23rd of April, and that session will be focusing more on kind of the next steps and future implications of the report, and we'll be joined by some colleagues from NHSC and also HEIW in Wales. So we look forward to engaging with you on that further work. So please do share your feedback on this session, and also your feedback on the report, and just a reminder that you can read the full report and the executive summary on our website. So thank you very much.
Thank you.
Thank you.
Thank you.